my name is Carlos Reines. I'm one of the founders and president of RubiconMD. By way of background, I'm a biomedical engineer by training. I've spent my career in tech and health tech, and decided to start this company about 7 years ago with my co-founder, Gil Addo. Company is very personal to me because of my own experiences with the healthcare system and having witnessed firsthand what happens when clinicians don't have access to the right expertise and all the challenges that that bring associated. I suffered it myself when had my accident in my own eye, and had to go through multiple surgeries and procedures that didn't turn out the way they could have had my clinicians had access to the right expertise. And that's in the inception of why I wanted to build a company that would support clinicians with better access so they can improve outcomes for their patients, and all of that under this mission to democratize access to medical expertise. And that's what led to the creation of RubiconMD when I met my co-founder Gil. And basically what RubiconMD does is that we connect primary care clinicians and specialists for remote consults. It's not to the patient, it's not direct patient telemedicine, it's clinician to clinician, right? So whenever a primary care clinician has seen a patient in the clinic and they have a question that they would like to ask, they access our platform, they provide a brief description, they choose a specialty, and that is sent to one of the specialists that we have on our platform, and they will review that and respond back to the PCP with their impressions and recommendations, typically in a few hours. And that input helps the primary care clinician make a much more informed decision around diagnosis, treatment, and next steps for their patients. In the US, it's been measured that about 40% of the referrals to specialists are actually unnecessary or things that could have been solved in primary care. On top of that, you have that almost half of the country really struggles with access to specialty care. If you're uninsured, if you're Medicaid, if you live in a rural area, it's very hard to go see a specialist. So we have a system that's very costly, very inefficient, fails to provide access, and that means a lot of the burden falls on the shoulders of primary care clinicians. And we decided to build a tool to supercharge primary care clinicians and help them drive more value in primary care, better outcomes, and make the system more efficient. And obviously, there is a very direct patient impact where patients not only get access to the right care plan much sooner, but they also avoid all the inconvenience and potential complications. So sort of a win-win for everyone involved in the value chain. At the core of what we do is we have this web platform that can be very easily deployed in any clinical setting. Most of the times it's a primary care clinic, but now it's also virtual care providers or providers taking care of patients inside the home or inside a skilled nursing facility, anywhere they are. It's a web portal. They access it with their username and password. In some instances, we can also integrate this with the electronic medical record if they have the capability, but otherwise you can just access it online. And then the clinician can typically provide a few items that are necessary for the specialist to give an opinion. So they enter that into the platform, they select one of the specialties, and as I mentioned, we have more than 140 specialties and subspecialties. Sometimes they can add attachments to the e-consult, right? If they are asking a question to a dermatologist and they would want to take a photo of a rash or a mole and attach it to the form, that's great. They could do the same thing for lab reports or even x-rays or EKGs for cardiology questions. And that is all submitted and it reaches one of the specialists that we have across the country. And I think that's where the true innovation happens, Lynn. We are taking any PCP in the country and connecting their question to the brain and the expertise of some of the best specialists across the country that are generally highly concentrated around the big cities, the big brand academic medical centers. So we're taking that expertise and democratizing across any PCP in the country. And it's very seamless for them. The specialist will review and respond. It takes a few minutes of their time. They can do it on the go. And that input is tremendously valuable for clinicians. In fact, primary care clinicians report when they use RubiconMD that about 80% of the times, 80% of the times, they are able to significantly improve the patient care plan. So the guidance they get from specialists is really helpful for them to do better care. And on top of that, about 70% of the times they're learning. So not only they're helping that patient in that given day, they're also learning about a specialty, a condition, and building capacity that they'll be able to use for future patient care. So that's great because we're constantly elevating primary care. And the result of that is that not only patients are getting better outcomes, but they're also avoiding sending them unnecessarily to a specialist, and that helps alleviate the pressure in the system, right? Where there's already enough of a wait time. If we can remove the visits that don't need to happen, everyone benefits from it.